When it relates to this full Med-Surg section, it's extremely important that you understand what labs are associated with what diagnosis and principles that support why those labs might be elevated or they might be down. Now, the last thing that I want to hit on Med-Surg is I told you on the NCLEX there's a lot of diagnoses that they have what's called trademark signs. I call these trademark terms to help you understand that they're related to a specific diagnosis. With GI, you want to remember ulcerative colitis can be left lower quadrant abdominal pain, and that one's going to have the bloody stool. Diverticulitis can also be left lower quadrant abdominal pain, but they talk about avoiding foods with diverticulitis with the small seedy foods. Appendicitis is your right lower quadrant. Appendicitis, they talk about rebound tenderness at the McBurney's point, and you need to be concerned if there's a sudden relief of pressure because that's a sign that your appendix burst. If they use the word weakness in a prioritization questions, weakness can be a sign of either hypoglycemia or more specifically stroke, especially in the emergency department. If we write weakness on the board, we need to assess that patient quickly, especially if it's new onset weakness, unilateral weakness. Pancreatitis is always going to be epigastric pain that radiates through the back. Cholecystitis, which is inflammation of your gallbladder, is going to be epigastric pain that's accompanied with shoulder pain. Your kidney stones are going to be flank pain that radiates to your bladder or your suprapubic area. If they talk about nuchal rigidity is a huge term for meningitis. If on these priority questions they talk about your patient saying that they've got the worst headache ever, that is a sign that they have an increase in ICP, intracranial pressure, and you should immediately be looking for vital signs that are associated with Cushing's triad. It can be meningitis or it could be a sign of a head bleed. With tuberculosis that we talked about recently, tuberculosis is going to be those night sweats, low-grade fever, and hemoptysis. And then also Guillain Barre Syndrome. That's when you're going to have ascending paralysis, and they always talk about that one as well. That's going to be concerning. Remember to keep watching these sections. I know you're going to master them, and if there's any concepts that you don't understand, make sure you go back and re-watch the videos. Really try to get the information to support the principles related to the diagnosis, how they're going to be treated, or expected or non-expected finding, so you can make sure you answer all the Med-Surg questions and the priority questions when it comes to actually taking the NCLEX. Thank you all for investing in Pass with Pass, and thank you for investing in yourself. You're doing what it takes to invest in yourself, invest in your success, and we want to hear about it after you cross that threshold. It's only going to be a matter of time. You're going to sit for that test and you're going to pass it, and you're going to earn the initials that come with that. And I hope that your job and your career is equally as rewarding as the one that I have being able to help you. You got this. Stay confident, stay focused, and let us know when you become a nurse and what you're doing. Thank you very much.